Hi guys. In this video I want to continue my discussion about the National Health Service and my experience with it in the UK as a new British citizen and a recent resident. Now, the NHS in the UK is basically the national religion. And, as I haven't made it any kind of secret, in the past I was an itinerant Christian minister. I used to teach at a lot of Christian conferences, and I was involved in a lot of churches and charities and these other things. And the same kind of conversations and cognitive dissonance that I used to see in the realms of religion, I very much see in the realms of politics, and especially surrounding the NHS. Now, with that said, as the NHS continues to increase its public relations budget, while that money could better be spent on nurses and doctors, I've quite encountered a lot of ire and a lot of vexation over my videos basically criticizing some of the aspects of the NHS that I think could be improved. Now, I want to make it very clear, my intention about criticizing the NHS is generally to have a constructive discussion about the real problems and possible real solutions that I think are necessary to make the NHS truly the best healthcare system in the world, or at least the best healthcare system for the British people. And the use of catchphrases and out of context comments and false dichotomy comparisons is not really helping the discussion. So anytime I'm discussing the NHS, there are basically four major talking points that I encounter, and I'm going to be addressing each one of those in this video today. Now, in talking and criticizing aspects of the NHS, you are more than likely going to encounter either an NHS true believer or possibly somebody working in the PR department from one of the National Trust, and they're going to use repeatedly a lot of catchphrases, such as the NHS is the greatest healthcare system in the world, or at least we have no bankruptcies for healthcare in the UK, and a lot of these other kind of virtue signaling sort of comments. It's very much akin to when a religious person quotes a verse out of their religious text as some kind of authority. It may not necessarily be based in truth or reality, as the case might be, but it's just what they've been told for many years and they assume to be true. But the fact is, the NHS system, not the aspects of universal coverage, but the NHS system itself has never been replicated by any other country around the world. Now, there are other countries that do single payer, such as Canada and New Zealand and Norway to a certain extent, but none of them have the similar makeup of the National Healthcare Service in terms of the bureaucracy. And if the NHS was truly the best healthcare system in the world, we would expect to see it replicated time and time again all over the world. And the fact is that is not actually the case. There are most developed countries in the OECD, and all of the OECD and most developed countries, all have a form of universal coverage which is free at the point of use. There's usually some kind of government intervention plus some subsidies, but not all of them are doing the particular bureaucracy of the NHS system. So the NHS is not unique in offering universal coverage by any means, but it is unique in the bureaucratic system that nobody else has repeated. So by using these catchphrases and other things like that, there's no basis for that in the reality. And for those people who say, well, at least there are no bankruptcies, I think this is a very, disturbing comment to say the least. I know, for instance, many years ago when my sister was diagnosed with cancer and she subsequently passed away, if I had known there were treatments that I would have been able to pay for, even at the expense of bankruptcy, to have my sister still alive with me today, I would have paid it. And kind of comparing the idea of, saving money at the expense of people's lives is not really a good selling point at the end of the day. And anybody who's looked at the data at other healthcare systems in Germany, Belgium, and elsewhere would see that the survival rate for people, especially with certain types of cancers, in other countries is much higher than that of the NHS. And it's not to say that we don't have treatments or access to care, but it is the bureaucracy itself has created a lot of internal inefficiencies that create long waits for test times, long waits for treatments, rationing of care, and these other things, which other countries do not have these problems. I mean, you do not hear in last year, 2017, we had the winter crisis. Over a couple thousands of non-essential surgeries were cancelled and these other kinds of things. All of that is unique to the NHS. There is no other healthcare system that is warranted these types of crises practically on a yearly basis. So the use of these catchphrases almost as a misdirection is usually a good sign that you're dealing with a true believer or somebody who is working in the public relations office, but it's not necessarily grounded in any kind of fact or reality. Now, the second most common objection is always this false dichotomy of trying to compare the NHS system to the American healthcare system, as if these are the only two options in existence. And again, this is a false dichotomy because the American system is not universal coverage, it's not single payer. It's not even really a free market system. It's kind of a collusion between state and federal governments with the insurance companies. So the more money that is pumped into the healthcare system, just the higher the premiums go, and the insurance companies pocket the difference. There really isn't a lot of competition, a lot of free market principles that is required to bring down costs and efficiency. I mean, if you compare it to something like plastic surgery or LASIK eye surgery, where there is a lot of competition, a lot of innovation, these tend to be the only areas of healthcare that have repeatedly come down in cost versus rudimentary care and other types of surgeries, cancer care, and these other kinds of things, where the cost has been continuously increasing. Now, it's very, as again, framing the argument against the NHS with the American system is basically a false dichotomy. When the OECD does a healthcare study and they try to compare like with like, so single payer with single payer, or socialized health insurance with a socialized health insurance system, and they compare the NHS to Norway or New Zealand, which is kind of similar in its single payer, the NHS actually doesn't do that well, right? It actually comes in, I don't know the exact figure, but we're not in the top 10 in terms of actual patient outputs and patient care and survival rates. So again, this constant framing of the conversation to compare it with the American system, which in many times, yes, the NHS actually does look better than the American system, but again, they're apples and oranges in the comparison and in terms of expenditure and these other things. In that case, yeah, it's not really a good comparison. Like, I have literally made the point that nobody is suggesting that we should adopt the American system, to have a rebuttal from one of these, true believers right after I've said that, to say, well, why are you proposing that we adopt the American system, even though that's exactly the opposite of what I said. So again, this myopic thinking comes from politicians, comes from true believers, to think that the only alternative is somehow the American system, which is clearly not. Like, I, for one, have advocated for closer to the Singaporean system, or some of the systems that we see out in Asia. And again, all of these are universal coverage. All of these are free at the point of use, but it's a combination of free market principles with social health insurance and other types of avenues to get that type of coverage. And I think we could learn a lot from these other types of systems. But again, yeah, comparing it to the Americans, that's when you're dealing with somebody who really, it's more of a propaganda spin than actually based in reality. Now, the third thing that you're inevitably going to encounter, just as there's Godwin's law, as my good friend Amos recently put out a video about, there is also the Commonwealth Study. Now, the Commonwealth Study was a measurement of healthcare systems around the OECD out of 11 countries, and the NHS ranked as number one. And this is usually touted by politicians and pundits and true believers and zealots of the NHS system to try and point to some kind of evidence that the NHS system is the greatest healthcare system in the world. Now, the problem with that, of course, is, well, first of all, that is an outlier. There are a number of other studies that have been done. The OECD has done studies, the European Healthcare Index has done studies, independent medical boards have done studies, and the Commonwealth Study, as general as the NHS is the highest ranking healthcare system, is an outlier. Most other studies that rank it pretty bad, sometimes behind countries like the Czech Republic and possibly even Slovenia and others. But the reason for that is quite simple, right? The NHS study done by the Commonwealth Fund basically was a study of inputs. That is how easy it is for the bureaucracy to function, as in doctors requesting certain types of forms, different types of accountability and administrative functions, which is perfectly fine. You can definitely measure these factors when it comes to healthcare, but it does not measure the most important aspect to any kind of healthcare system, which is patient care and the health and well-being of the patients. Of which the Commonwealth Study, basically ranked and said that, the NHS actually was not doing that well. as the left-leaning Guardian article on the Commonwealth Study actually pointed out that the only black mark against the NHS was its ability of actually trying to keep patients alive, right? So again, this is always the one study that is cited by these true believers. And again, there are other studies that show that the NHS is actually not doing that well, especially based with other types of healthcare systems right on the European continent and out in Asia and elsewhere. So again, the myopic thinking that the Commonwealth Study is the be-all end-all of it is basically somebody who's trying to spin some propaganda and not necessarily informed about the broader scope of studies that have been done on the subject. Now, lastly, these opponents are basically going to say that the only thing that we need for the NHS is more money for the NHS, right? And again, I would argue that that's not necessarily the case. Now, I will be upfront and say, look, I'm not entirely opposed to putting more money into the NHS as a short-term stopgap. With the mass amount of immigration that is coming into the UK, which is clearly straining an already strained system, I'm not opposed to that, at least in the short term. However, systematically, the systemic system of the NHS, that is not going to solve any of the bureaucratic inefficiencies or solve a lot of the wait times, and as well as, the high death and mortality rate that are coming from the systematic problems within the NHS. Now, I know the Labour government definitely increased funding, and there was an improvement in some aspects of the NHS functionality. However, a lot of that went to administrators and some of the bureaucratic instruments rather than actually reaching doctors and patients. But nonetheless, I think there definitely needs to be a revision on a lot of these things. So a lot of people who espouse that the only solution is more money, they really haven't looked at the data. There are a lot of other countries that are spending actually less than the NHS and actually getting better results. So simply just throwing more money at a government monopoly is not necessarily going to solve all of the problems. And I'll put it to you like this. Have you ever heard of a government department that basically said, we have solved the problem that we were commissioned to do, you can stop giving us money or more money, the situation is resolved? And of course the answer is no. No government institution is actually incentivized to solve what they've been commissioned to do, because that means their government department is going to be put out of business. So if the government actually solved, say, the poverty issue or the homelessness issue or had an efficient healthcare system, they would not have the incentives to go back to government and basically commission and lobby for more funding. So there's an instinctive inefficiency built into every government institution, and again, the NHS is not immune from that. Again, like recently we had the winter crisis. It was actually quite intense that, it may have actually called for major reforms. The public relations department came out in full force and said, no, we're not that bad. We don't need reform. We just need more money. And this has been a continuing cycle for years. Similarly, even the national defense budget was threatened of being cut in the UK. And suddenly, the generals basically discovered the impending threat and danger that Russia poses to the European continent and to the UK. And that's why they suddenly needed all of their money, probably an increase in their budget. So this is a normal scare tactic done by pretty much every government agency. But when you look at the efficiencies, we know that the NHS has been overspending on things like gloves and just basic equipment and so forth. Their administrators making six-figure salaries, and a lot of these other types of things, that money doesn't necessarily reach the doctors and the patients for their care. So again, I'm not opposed to more money, but at the end of the day, throwing more money at an already bureaucratically heavy, inefficient institution with high mortality rates is not going to solve any of these problems. In many ways, in real terms, the NHS has gotten more money every year, but doing the same thing over and over again and expecting a better result is the definition of insanity. I think there are much better elements that we can look at. A lot of these people try to demonize the idea of privatization, and again, I don't think that the government really understands free markets or any of these types of things. Again, I'm for more competition, more efficiency, definitely more aspects where people can have choices, and empowering patients to make better decisions regarding their healthcare, rather than leaving it in the bureaucratic mess of the GPs and the NHS. So guys, that's my video. Tell me if you've encountered any of the other common objections. when having these discussions. And again, I point out, I want the NHS to be the best healthcare system in the world because I, as a UK resident, I'm going to be relying on it in years to come. As it stands right now, every time I go back out to Trinidad and Tobago, I do all my checkups, I do all of my testing and so forth out of my own pocket. And because, frankly, I cannot rely on the NHS as it is right now. But one day I'm going to have to. Thank God I haven't had any major health problems. But if I do one day have an issue, yeah, I have to rely on the NHS. And on one final note, look, I'm not saying that people who actually get care from the NHS are not getting good service. And again, I'm not saying that the doctors and nurses are not overworked and all of these other things I completely accept. I'm just saying that there are other things that we need to address. So with that, be sure to like, share, and subscribe if you'd like to see more. Be sure to connect with me on social media. I will put all of the links below. And if you disagree with me, that's absolutely fine. If you work for the NHS and you're one of the PR people that they've hired, I respect that. But if you're going to come at me with any of these points, I know that you're not really interested in an honest conversation. So again, that's my video, guys. Thanks for watching and take care. Bye-bye.